Good afternoon, everyone. Welcome to this month's AFPHM webinar. Today we have Dr. Tony Gill presenting on advanced training in public health medicine. If anyone connecting in has any questions, please use the Q&A pane located at the bottom of the control panel to submit your questions. We will have time for questions at the end of the presentation. I'll now hand it over to Dr. Gill.
Well, thank you very much, Terence. First, welcome to this webinar. And if you go to the next slide, please, Terence, which will be on advanced training in public health medicine. Before I start, I would like to acknowledge the traditional owners of all of the lands on which we meet today, and I pay my respects to their elders, past, present, and emerging. I also pay my respects to any Aboriginal and Torres Strait Islanders who are actually taking part or listening to this webinar. So I'm the chair of the Faculty Education Committee, and the aim of today's webinar is to provide information about the current advanced training program, but also I especially welcome the fact that supervisors have been invited, and hopefully we'll see this as well, so that as well as trainees understanding the advanced training in public health medicine, their supervisors also understand the advanced training. Next, please. So what I'll be covering is a training program overview. There'll be information about the learning contract reports, also including information about the workplace reports, and also the requirements for the oral assessment in October this year. Next slide. So from the faculty's perspective, there are important people who you will interact with. For any training queries, you can see the email address there. Anusha has been our education officer, but unfortunately she is moving on soon, and we'll have a new education officer there to pick up that. But that email address is a standard one for any training queries, plus the telephone number. For any assessment queries, contact the education officer. There's a contacts for the examinations for those who are considering doing the oral assessment, and as well the faculty office, which actually is involved with the webinars. We now have Jess there, Rachel, who was previously there, has left the college, and Jess is her replacement. So welcome that. So that does give some background to those. Next. So I think a few reminders for everyone about the training program. It is an advanced training program only, so we don't have no requirement for basic training. I'd like to reinforce that it is around adult learning, and that you as trainees are actually responsible for your training and need to actually influence your training and are responsible for all the paperwork that is required as part of the training program. Next. So I think, as you're all probably aware, the curriculum for advanced training in public health medicine covers numerous broad areas: general professional practice, cultural competency, information research and evaluation, policy, health promotion and disease prevention, health sector advocacy, development and management. And the intent is that trainees will gain competencies across this broad curriculum. And that may be through direct experience, hands-on work, or potentially in some cases by doing other activities for those parts of the curriculum for which they may not come across in their day-to-day work. Next. So as a reminder, the training requirements, this advanced training, is for 36 units of training, where a training unit is a full-time equivalent month. And I think that's probably just, so therefore training is a minimum of 3 years, but can be extended over a number of years, be it by taking time away from training for whatever reason. So obviously the requirements, there is the Public Health Medicine Advanced Training Curriculum, and also there's a Professional Qualities Curriculum. And you need to be across those and the competencies as you consider your training in either the role you're currently doing, and also what any future training opportunities might come up to enable you to actually get experience and competencies across the full curricula. Supervision is a very important part of the training requirements. For every period of training, and that can be from months to a year, a trainee requires a supervisor, a named supervisor for that process. The intent is that the supervisor should be a fellow of the Faculty of Public Health Medicine, but it's understood that in a number of workplaces, the immediate supervisor for a trainee may not in fact be a public health physician. And in those circumstances, there is a requirement to have a public health physician as the co-supervisor. This person doesn't necessarily have to be in the same workplace. The intent of the co-supervisor is to ensure that the trainee is given feedback and advice relating to the training program public health medicine, for which a workplace supervisor may not be in a position to do. As well, for not only every period of training, but in fact for the whole of one's training, trainees require a mentor who is a fellow of the faculty. There is a special dispensation for people for maybe not to have a fellow, but that is very much the exception. So the aim of the role of the mentor is to be someone who a trainee can go to, and it might be that if it's the same person over a number of years, they can help provide advice to the trainee as they move from supervisor to supervisor with suggestions of how they might better get their opportunities for training, get their competencies. But it does also gives the trainee somebody to speak to separately should there be issues with their supervisor. Should there be issues with their supervisor is also the regional education coordinators, which we'll come to later. Next. So there are a number of teaching and learning requirements as part of the training program. So for every year, there's a minimum of one learning contract. And I'll go into learning contracts a bit later. The reason it says a minimum is that you might actually have a number of different roles or positions within a year. But a learning contract, the maximum length of time for a learning contract can be in place is 1 year. There are national training days, which are recommended, not compulsory. They have been planned for later this year, but obviously, as you're all aware, we are living in interesting times and we'll need to wait for further information what's happened about the national training days this year. There will also be a number of trainee video conferences, again, are recommended and not compulsory. Next. Although this is actually, all of you as trainees have got past this stage, I suppose it's really a reminder for trainees and supervisors that should they come across people who are interested in public health training, there are requirements to get in. These are in the handbook and other areas, but I think it is worth, you as trainees could easily be asked by other doctors, what do I need to do to get into public health training? So for completion, we have included this here. So as you'd be aware, you now need a completed Master of Public Health, and you need to have your MPH or equivalent needs to cover the 5 compulsory core discipline areas. I think it's just you as people who people might contact, it's useful for you to be able to reinforce to people who are contemplating public health training the requirements for the MPH. Next. As well, there's the application to commence training. There might be trainees who have got through the MPH and other requirements but are waiting for a position. obviously that the application to commence training is really about the full eligibility for public health medicine. And it actually remains extant for 12 months from when people are found eligible. So if somebody's been found eligible and the MPH and entry requirements, the application to commence training once you're in a position is important, but needs to be in the time frame. But hopefully you all as trainees are past this stage. Next. So the advanced training program, the intent of it is to provide you all with experience in the practice of public health medicine in appropriately supervised and supported environments. And as those of you who have been in training for a while understand, there are different levels of competency. And obviously you might start off, your experience might be assisting in doing a particular activity, and in later times of your training, you might actually be doing activities more yourself in a less supervised environment. As mentioned before, the requirement for 36 units of training, where a unit is 1 month of FTE training. It's delivered through the workplace. So I suppose in this way, it's no different to say clinical training where you're doing through the workplace. But the aim is that through your workplace, through the activities you do in the workplace, you are picking up your experience, you're picking up your competencies. And that is why for some trainees, there may be significant advantage in moving to different locations or different positions to actually get the full range of public health competencies. The content is defined by the learning objectives in the Public Health Advanced Training Curriculum, which lists all the competencies that are there. Next. An important part of all training in the college is that it needs to be conducted in accredited training sites. And in the Faculty of Public Health Medicine, accreditation is by the Faculty Education Committee. There is a list available, but if you're going to a site which isn't accredited, you'll need for the site to arrange to apply for accreditation. This can be an issue with trainees in that unless people are in sort of positions already accredited, they're going to a position which they want to use for training. Any training time cannot be accredited until and really it's from the time the accreditation is put in for and accepted and approved by the Faculty Education Committee. So I certainly stress all of you, if you're moving into a new position, even if it's in a month's time or 2 months' time, ensure it's accredited, and if it's not, have discussions with the site to put in the accreditation paperwork. So I think that's important. There's a contact there for accreditation. Next. As I mentioned before, across the training program, you need to seek a range of training opportunities. I mean, this reflects that not all positions that trainees are in can actually give you the full range of competencies and experience with those. Yes, if you're in a public health unit, there's maybe more chance to not require other ways of seeking a range of training opportunities, but certainly there are a number of trainees who are in very different positions where the range of competencies that can be attained are limited just because of what the position is and its role. There are ways that people can get greater training opportunities, be it formal rotations to other positions, potential secondments somewhere else to actually pick up over a period of time, or varying, in fact, in employment positions people are in. And certainly, I work at the Therapeutic Goods Administration. What we've had is a number of trainees at various times actually going to the ACT Public Health Unit, or in some cases in Victoria, to the Public Health Unit or the department to gain a broader range of competencies. So what people should look at the current training position they're in and really think about how they might get a full range of training opportunities to cross the competencies over their period of training. Next. One of the opportunities that people have is overseas training. And the policy is that you may do up to 12 months of training in an overseas-based position. This needs to be approved prospectively, and the position needs to be accredited as well. So this really needs a bit of planning if you're considering overseas training. And we've had a number of trainees who have done overseas training. Some have done with WHO positions. We've had a number do it in working for organisations and non-government organisations in, say, Africa as well. So it's certainly a good opportunity to get a broader range, but it does need a pre-work. In these cases, you will need a local supervisor, and it's probably very unlikely they have a fellowship of Australian faculty. In those cases, a co-supervisor will be required who's an Australian-based faculty member, and what their role there is to sort of also guide you and make you think about how the experience in an overseas position may even relate to the practice of public health medicine in Australia. For that reason, trainees can complete overseas placement for up to a year, but must do at least 2 years of training or 24 units of training in Australia or New Zealand. Next. The other one that's available is credit for PhD study. And I know a number of trainees at various times have been undertaking PhDs, but you can only include a maximum 12 months of PhD-related activity in the training program. Really, the reason behind that is a PhD in its study in all those areas will only open up some competencies, and you really need some broader experience than just doing research to achieve really the broader competencies required to be a public health physician. The Faculty Training Committee must prospectively approve any training plan for this, and the PhD must be relevant, obviously, to faculty public health medicine competency areas. If you're doing a PhD potentially overseas, it's a combination of 12 months of PhD or overseas training in total. So therefore you still would need to do 2 years of training in Australia. Next. I mentioned earlier about mentors. Although the slide states that a mentor must be for a whole training program, i.e. for your whole period of training, it is not a requirement that the mentor has to be for the whole training. But the advantage of a mentor for your whole training program is they get to know you, they know what training you've done, they know what training gaps you might have to assist you. As mentioned, they must be a fellow unless particular exemptions given. They provide oversight, but they really are an independent guidance to you as a trainee on matters relating to your training, your well-being, and also aspects of career development. So I think mentors, we're the only part of the college at the moment which has a requirement for mentors, but I think it's very important to have a mentor. I would recommend you look at mentors in that area of public health medicine which interests you the most and which you maybe want to look at long term. And certainly there can be assistance through the RECs or other fellows to identify people to be appropriate mentors if you need assistance in that process. Next. So supervisors. As mentioned earlier, you need a supervisor for each training position or posting. Obviously, they've got a number of roles to support you in your training program. I suppose I'll reinforce that, as mentioned earlier, this is adult learning and it's your directed training. Everyone here is to support you. So supervisors will support you in planning and facilitating your learning path, opportunities for effective teaching and learning, feedback on your progress and achieving the competencies. They need to determine your readiness for summative assessments, but they also have a role in signing off on your learning contract and learning contract report. Obviously, if they're your workplace supervisor as well, there are potentially other requirements of the workplace, for instance, the public service would put on the supervisor in parallel to your requirements for public health medicine, like learning contracts. But the role of the supervisor in the public health medicine around learning contracts is really specific to your public health medicine training, but sometimes there are significant advantages when they're actually your immediate work supervisor. Next. As you're probably all aware, we have regional education coordinators, and I apologise for the spelling, which I only just realised. And in each state and territory, we've got a senior fellow who sit on the Faculty Training Committee, making decisions around training. Their role is to advise you and potential trainees of training opportunities. Where required, they can discuss the choice of supervisor and mentor. They have a role through the whole process. They get involved in reviewing when you had applications to commence training or eligibility. They also review your learning contracts and learning contract reports. They'll assist where there's maybe issues around trainees in difficulty. And they also have a role to keep the regional committees informed of training matters and to probably help use with the regional committees to potentially provide opportunities for training, education, or in fact, occasions where people can do some of their assessments. Next. So, learning contracts. I might preface this with people may be aware there's a big review of curriculum in the college, which has gone with, they've reviewed basic training, they're now moving to advanced training, and over the next number of years, there'll be some reviews of competencies and entrusted physician activities moving forward. But until any of that changes, we are in our current situation with learning contracts and learning contract reports. So I think the best way to see learning contracts is to get you as a trainee in discussions with your supervisor to come up with what roles, activities and projects you'll be undertaking during the period of training with that supervisor. I think the issue that some people have troubles with is that it's actually it's a different way, rather than looking back. But then a lot of workplaces, people do have work plans or other expectations from supervisors on what you're going to do over the next period of time. So the aim in this is to really write up and plan your learning and therefore training over the next period of time. It is certainly, I know it's sometimes seen as time consuming, but I think it does enable you to work through with your supervisor to work out what you're actually going to do around this. Next. So the learning contract, you link activities to competencies expected to achieve during the period. And I think, again, it's to give you thinking and your supervisor to maybe what opportunities are there in the workplace to achieve various competencies through various activities. There are some common problems that have been identified by the RECs, the Faculty Training Committee, on submitted contracts. And I think you need more than writing competency numbers. You do need to write activities that you're going to do and trying to identify which activities. And also, we see this in a few areas where people don't actually describe what their planned part role is in an activity. Rather than might be a project that's been undertaken by a group of people, but it's probably worth describing your proposed role at this stage. Next. So there is a requirement to submit your learning contracts within 4 weeks of the commencing of a position. I will at this stage, and I believe you've all received notification of this, that due to the current COVID-19 issues, the trainees who commence training rotations in the February to June period of this year have been granted an extra 2-week extension to submit their learning contract with no late fee for those extra 2 weeks. And it is possible to request longer extensions through a special consideration application. One of the issues I know that trainees sometimes have is trying to get their supervisors and mentors to sign off. It is your responsibility to do it, but I mean, we do know that there have been some occasions where trainees have had difficulty for a particular reason to get a sign off, and that might in fact meet the requirements for special consideration application. Obviously the aim is to get these in as within the 4 weeks, but as mentioned, there is a special increased time frame for this year due to all the work around the COVID. Probably the other issue is about making any changes to your learning contract. And I think that's probably maybe affecting a number of people as we speak, where the role you were going to be planning to do for the beginning of this year have been somewhat overtaken by events, and you might have been drawn in to other work around the current pandemic. You're only required to do a new learning contract if the work you're doing is significantly different, and maybe it's a different totally different supervisor, completely different role. If it's a variation on the role, then any changes to what was in your learning contract can be picked up in your learning contract reports. I think when you think about it, the learning contract is a plan for your learning over the next period of time, whilst the learning contract report is about what you actually did. So next. So the learning contract report is completed by the trainee supervisor and signed off within 6 weeks of completing a position. It actually will summarise what activities and projects you have actually done, as distinct from what you maybe plan to do at the start of doing the learning contract. It should actually detail outcomes of the activities undertaken and how they might link to the learning objectives and competencies. One of the issues around both doing learning contracts and learning contract reports is trying to keep a record of what competencies you have actually completed to whatever level of competency. One of the things at the moment which is provided as an optional template and is strongly recommended because I think it does make life easier is there's an Excel spreadsheet available on the website, and that can be used to track your competencies. So the advantage of that actual template list of the competencies you've done, it's also very useful for when you want to do a new learning contract and potentially with a new supervisor, to be able to show them what you have actually achieved. Due to some smart colour coding, once you've achieved the competencies on that template, it shows up in a different colour so people know what you've done. So I'd recommend that's used, and that can be submitted with the learning contract report without having to fill in the other table, which I think when I tried to work it out one day, if I joined it up, would probably take me 3 desks to be able to have it in a legible state. having it in this template is much easier and certainly would recommend it to people. Next. So, as flagged, the learning contract report will show what you've done, your roles, activities and projects, any outputs, training and conferences attended, a reflection by both the trainee and the supervisor of the activities undertaken, and noting that once you've attained the required level of competency, you don't have to repeat it on subsequent learning contracts. So it is actually, I think, a fairly important part. The learning contract report is not a formal assessment tool at all, but I think it's a very useful one for trainees to know what they've done in their discussions, and also informs future learning contracts. Next. As I flagged, when you change project or activities from what was on the learning contract, you just need to ensure that it's obvious in your learning contract report what changed and why. And as I mentioned, I'm sure there might be a number of people whose work either has or is currently being affected by the significant public health medicine work underway with the pandemic. You do need to have your reports signed off by the supervisor and mentor, and I'm not sure what's happening there, Terence. We've got lots of different things going through. Terence, can you fix up we're seeing a lot of activities we don't need to see on the presentation. Thank you. Next, there are late learning contract reports and a requirement for those. There is also, if a trainee has issues of getting in learning contract reports within their control, there are issues through progression from training, and the training time may not be accepted for that period of time. Next. As people are aware, there are a number of workplace learning and assessment tools that you're required to do through your period of training. So there are 3 direct observations of practical professional skills, or DOPS. There's the formative oral presentation, 2 summative oral presentations, 3 professional quality reflections, a research project, but that also and also workplace reports through the period of time. Next. So there's a formative assessment, so one oral presentation, which is really one in recommend the first year of training. I think it's worth noting the oral presentation and assessment of an organised oral presentation of at least 10 minutes duration, but what is looked at is the organisation and how you do the presentation. Unless you're doing it for the Jerry Murphy, the actual content is not part of the assessment, but any questions on the content are part of the assessment in the way you actually can deal with questions on what you presented. I think it's fair to say that the oral presentation is probably one of the easier tools. Next. The summative presentation is the other 2. You need to do 2 of those over the course of training. Although we say there maybe these formative in the first and summative in the second, they can all be done through, but it needs to be done by the end of training, and there's a number need to be done before you can sit the oral assessment. And you have a requirement to submit them. Does need 2 AFPHM fellows to assess, or we can make dispensation if that's not possible. It's hoped that in your workplace there are plenty of opportunities, but as I mentioned earlier, regional committees or a few other activities may give you the chance to do a presentation. And in fact, if someone is more remote and has troubles, there's no reason why over something like Zoom or whatever, a trainee could potentially do a presentation to 2 more remote fellows. Next. One of the other requirements is the personal qualities reflection, and this is rare to see about insight into your professional development through activities you've observed and discussion potentially with your supervisor. One of the ones that we're looking at for the future is whether one of the personal quality reflection should be about cultural competence and so trainees can have a think through their cultural competence in dealing with Aboriginal, Torres Strait Islander or Maori health, which obviously is a very significant part of the public health burden in both Australia and New Zealand. Next. Go back. Direct observation of practical professional skills. 3 are required. This was based originally on clinical observation of clinical skills, but in the public health setting where that is far less relevant, you can see there's a number of potential types of work suitable for this assessment. We're chairing a meeting, as it says there, speaking at a forum, conducting an audit, running journal club, those areas which are far more in line with what public health fellows do. Again, there should be ample opportunity, but you do need somebody, you need a fellow to assess that. Next. Next, please, Terence. Thank you. So the next area is the workplace report. Previously, people had to put together a whole number of papers as part of their training. This was changed to workplace reports, where a report that you undertake in the workplace is able to be presented as part of the assessments. I think a few things around this. The trainee must be the sole or lead author of at least one of the workplace reports. As well, there is a requirement from the college for all trainees, advanced trainees, to do a research project. And as I'll come to in a second, this can be done in lieu of a workplace report, depending on when you commence training. And there is guidance about research projects and also guidance about what constitutes a workplace report. I think the biggest issue with workplace reports is that sometimes the work you're doing in the workplace doesn't meet the full format of the requirements for a workplace report. In those circumstances, what you need to do is provide supplementary information to cover off the areas not covered. So for instance, if you're doing a journal article, potentially might be a workplace report, that will actually probably cover off most areas that are required under a workplace report. If you're just doing a report in the workplace for something else, you might not actually have things like an abstract or methods which you'd have undertaken actually written into a report. So you need to look carefully at the information regarding a workplace report on the training portal. Next. So for trainees who commence training before 2017, you need to do 3 workplace reports. There's no requirement for a research project. For trainees commencing training since 2017, you need to do 2 workplace reports and 1 research project over the course of training. And for trainees who've been granted recognition of prior learning for their research project, you would need to do 3 workplace reports over your period of training. There are important dates for submission of workplace reports, which will come up later, but I'll just mention again, because of the current COVID issues, the trainees have been granted an extension to submit workplace reports, research projects, up until Wednesday, the 15th of April, via the training portal. The only flag I'll do, and then it comes up later, is if you're intending to sit the oral exam, you need to indicate that back to either with your paperwork or to the education person, so that it can be prioritised for its marking. Next, one of the other significant summative assessments is the oral examination. And this is completed towards the end of one's training and might actually be done after you've completed your 36 units. But this provides an oral assessment across the key areas of public health. It's organised in Sydney and usually takes place at the end of October, and later on we'll have the current dates for October. And it's a number of discussions of questions with panels of examiners. For those who are contemplating sitting, more information will be provided on that. Candidates, you also have a 45-minute reading period prior to actually going in to be assessed. And it does cover the key areas across the public health curriculum. For a number of years, there's been also an opportunity for a supplementary examination for anyone who maybe was found borderline on the main examination. Next. So to be eligible to sit the oral exam, take part in that, you need to be obviously currently registered. You need to have done at least 29 units of training by the 1st of December of the year. So by the time you make your application by 31 July, you will therefore need to have enough training, if you haven't already got it, such that by that later in the year in December, you'll have reached 29 units. In addition, you must have all your learning contracts up to date, and there are a number of assessments which must have been completed. So that's the formative oral presentation. Next. 2 DOPs of the 3, 2 of the PQRs, 1 of the 2 summative oral, and have at least 2 workplace reports being assessed as suitable. If you don't have these, then you're not eligible to sit. And that's why I reinforce that if anyone's putting workplace reports in and they're contemplating sitting, to advise so that we can ensure that they are prioritised to be assessed, so that by the time July comes, people are aware whether they were found suitable. You can have a maximum of 3 attempts at the oral examination, and that's probably enough on that. Next. So there are important dates, as mentioned earlier. Learning contracts due within 4 weeks. Special dispensation for the first 6 months of this year of another 2 weeks. All learning contract reports are due within 6 weeks. The workplace report submission normally will just be the 15th of March, but as I mentioned, it's been extended in view of the current busyness of COVID pandemic work, and there are 2 later times during the year to submit workplace reports. Next. I think the only one on this slide I want to reinforce for those who maybe have just come into training, that if you want to put in a recognition of prior learning, needs to be submitted within 3 months of commencing your first training position. Next. 31 July 20 is when people need to have applied for taking part in the oral exam. As you can see there, the current dates for the oral exam and the supplementary exam, you need to meet the requirements by 31 July. So end of October. Obviously, people may be aware the college broadly has deferred a lot of its examinations. We need to, obviously, like a lot of things to do with the current COVID-19 pandemic, wait and see. But that is a long way out at this stage. Applications open in August for a 2-week or 10-day, 2 working week period in August. Again, reinforcing the workplace report part. What I would suggest, although we obviously have potential uncertainty around later parts of the year, but if someone is considering sitting the exam, any work you would do between this year would not go astray should there be any changes to the exam timings at the end of the year. Next. There are a number of education policies that you can find as listed here on the website for areas you may wish to read up on. But probably in the interest of time, I'll now take, I'll take or see the questions that exist. What I will try and do and answer what I can now, and if there are any I can't answer, we'll be able to get back to anyone taking part in with the answers. So Terence, can you, how do I find that?
Yep, so if you want to open up the Q&A pane, you'll see your first question at the top ready to go.
All right, so the first question I've got here is, can trainees include competencies gained outside of their learning contracts within the template? If that's, there seems to be a couple of opportunities. One is, if your learning contract only said you were going to do some competencies, but you end up doing others, you can pick that up in your learning contract report. And that's where the learning contract report is there to achieve, to actually say which competencies you actually achieved. Hopefully that does answer that question. The next question I've got is, what is the difference in the oral and summative presentations? I take that to read, what is the difference with the oral, formative and summative presentations? For all extensive purposes, there actually is no difference. It's exactly the same, other than the marking guide and a few areas around it. And there is information in the handbook about that. But really, between the for all intensive purposes, the oral and the formative and summative are really the same presentation, but just looked at slightly differently when you do your first one. The third question I've got here is, are there any considerations of how to address the mandatory self-isolation requirements for the oral exam, e.g. oral exam via Zoom for New Zealand trainees? I think all I can say is we need to watch and wait on that area. I think October is a long way away, and I suppose, as we all know, even with the current pandemic, days can change policy and do things. So I'm not, I think that really, when the time later in the year when decisions are made or looked at, there obviously will be looked at how we potentially do the exam, if the exams need to change either by time, deferred or anything. But I think that'll probably be a question we'll need to consider later in the year when we have a better understanding of what's going on. The next question I've got, and for that matter, how to include external examiner. I'm just not sure, trying to check the context of that. So I might need more information about what.
Sorry, that was a add-on to the last question you just answered.
Oh, right. Okay, so it's just, yeah, we'll just need to see at the end of the, how the exam process is going to work. Next question I've got, if I participate in projects outside of my rotation workplace, can I put them on my learning contract? Well, the only difficulty with this would be supervisor. Have your supervisor to sign this off if you've done it. As well, you can't do more than one FTE of training time. So if you're working full time and then doing other projects outside, it doesn't gain any training time. I haven't actually it's an interesting question, but as a general rule, we really only cover whatever you're doing within your rotation workplace with your supervisor. Next. Is there a regional education coordinator covering the Northern Territory? At this point in time, I cannot give an answer to that. We maybe will need to get directly back to the question, so we probably just need that question held over, Terence, so we can get back to the individual concerned. Next question I've got, does the research project have to be submitted in September the year prior to sitting the exam, or if 2 workplace reports have been submitted and accepted by July, can the research project be submitted later? I need to check my notes. I think, but I'll again take this on notice, that 2 workplace reports, which may or may not include the research project, need to be done before the exam. I don't think there's a differentiation between a workplace report, which is a research project, and a workplace report, which is not the research project. But again, we'll take that one on notice to see how we can do. Next, I'll go to can our supervisors be the one to assess our DOPS? I haven't got the exact policy in front of me on that. I will again just confirm that one. I know it's explicit for the oral presentation, it can't be the supervisor, but I'm just checking what I said earlier. I'll take that on notice so we can just confirm that one for everyone. I think what we'll do is we'll do a bit of Q&A for these ones which I can't answer, which aren't obvious. So we'll just confirm that one. So we'll need to pick that one up. Next question I've got, does a trainee have to be in inverted commas training work at the time of the exam, e.g. if they've finished their 36 units of training prior to the exam, are they regarded as being on interrupted training pending exam result? I need to fully clarify that, but I think there is, once you finish 36 units of training, I think there is a requirement as part to be within the college training system to be on interrupted training for the exam up to the period of exam. That's my understanding, but we'll take that one on notice as well, please, Terence. If you could put these ones together into an email, we can then get answers for all of these.
So I don't have the attendees' email, so I think it's best if they email you the questions and you get back to them.
Well, what I know, we might try and work out a better way. If someone can email the questions, I'll give you my email address.
Yeah, I'll provide them with your email, and they'll email you their questions, and you can respond to them.
Right. Okay, well, I think that's all the questions I've been given at the moment, unless anyone wants to jump in at the end. So thank you for your time. What I am also hoping that supervisors have either listened in or will be watching this in future so that they also have a good understanding. So for the trainees' benefit, there is also training being put on for supervisors. And there's a special public health medicine module. As these are face-to-face, they have, for obvious reasons, been currently just put on hold, like a lot of activities. But it also might be worthwhile for trainees, once the webinar is fully available, to inform their supervisors, who, as well as the handbook, can use this as a reference to the requirements of the training program. And probably would be worthwhile letting your mentors know as well, because at least this gives them a feedback and understanding of the current training requirements. So if there's nothing further, Terence?
Yep. If you're happy to wrap it up there, if no one has any more questions, I'm getting people saying very helpful session. Thank you.
Okay. Well, thank you all for those who managed to do it. For those who are very busy on the COVID pandemic, there are always issues we have of selling ourselves as public health physicians and what we do. And certainly, I think at the current time, there is significant reinforcement of what public health physicians can do and what we bring, especially when we have a current Deputy CMO, Paul Kelly's a public health fellow, Brett Sutton in Victoria, Nicholas Speria in South Australia, Kerry Chant in New South Wales, Mark Veitch in, I think, Tasmania, and Karen Coleman here in the ACT are all public health fellows. And I think from what I've seen and heard are all set very good examples for public health medicine. So thank you all very much and good afternoon.
Thank you, everyone. That concludes today's webinar. Please join us next time.